million men
140 million, yeah.
worldwide, potentially have ED.
But typically men in their 50s and 60s, it's a little bit more common, and then older. But again, in the office, we're seeing younger men coming in, starting to notice some changes and going, okay, wait, I can do something about this.
Apomorphine, and we are going to talk about that because that's a potential medication that you can use for erectile dysfunction. So it works on an area of the hypothalamus, so in the brain. And so it is, again, potentially a little more faster acting for that reason too, where your PD5 inhibitors are working peripherally to increase blood flow. Welcome back to the Rev MD Podcast with me, your host, Dr. Deborah Durst. So I am a traditionally trained physician that now specializes in regenerative medicine, but specifically in sexual medicine. And if you like having conversations about sex and you're new to the podcast, then like and subscribe and share with friends, because we're opening conversations about sex and sexual health and solutions. And I have my co-host, my very entertaining co-host, Faraday, with me today. So I'm going to let her say hello.
Hey guys, Faraday Golembieski. I am a board-certified nurse practitioner here at Revitalize MD. So we are excited to talk to you about a new medication for erectile dysfunction that a patient brought to our attention.
Correct. And I don't really know that it's new, but we'll talk about that. New to us for sure. So it is apomorphine, and we are going to talk about that because that's a potential medication that you can use for erectile dysfunction. And we're going to talk about what it is, how it works, again, and
how it differs from traditional medicines
for ED, and again, what ED is and how it differs from, Cialis, Viagra, and all those other oral solutions. And again, if you stick around to the end, we will let you know if we're using this in practice at our office. So again, we'll just get right into it. So again, new one for us to talk about on the podcast. So what is ED to start with? Because this is one of the potential oral solutions for ED or erectile dysfunction. And so 140 million men
yeah.
worldwide, potentially have ED. And so that's a huge and very pervasive issue. And so looking for solutions and different ways to deal with that. And oral solutions are one of the mainstays of treatment for ED, and internationally, worldwide, but also here in the U.S. and by urologists here. So that's ED in a nutshell. And again, now, what are the different treatments historically used, really, when it comes to oral use?
Even with the amount of men with erectile dysfunction, I think it's interesting that when we do our research, right, and we kind of look into it, it talks about generally men over the age of 60, but we're seeing men in their 40s coming forward. So we're seeing a lot younger population being more proactive, but typically men in their 50s and 60s, it's a little bit more common. And then older. But again, in the office, we're seeing younger men coming in, starting to notice some changes and going, okay, wait, I can do something about this. What do I need to do? They're being more preventative. So there is more regenerative now, but that's not traditionally the case.
Yeah, no, and I think that's a great point because, again, it's clearly more prevalent in 60 and above. And, the older that you get, potentially more, moderate to severe in the way of symptoms. But we see a lot of men at a younger age with that. And so again, having different solutions, and like Faraday talked about, regenerative solutions are a mainstay of our office and in our services for men. But we love to explore different options, different treatments, different supplements even. And we've had a previous podcast on Pygium that was quite popular. And that was a patient that brought us that as a question. And so we did.
And then nitric
research.
oxide we've done.
Yeah. So we love when you bring us ideas or leave them in the comments because we love to hear those. We love to interact, but we also love to look into it and explore and see if that's something that we want to add or improve in our practice. And so when it comes to apomorphine, again, what is that? And so apomorphine is a dopamine agonist. And agonist means it's actually kind of a positive benefit to increasing dopamine. So
Yeah, so it wants to
historically,
mimic it in the body
yeah,
and increase it.
increase it. And so again, used for historically for Parkinson's disease. But we looked again, FDA approval here is only for an IV formulation,
In an
correct?
injectable form. Yep.
Yeah.
An injectable form for Parkinson's,
Yes.
for acute intermittent hypermobility is the indication for it. But interesting enough, in Europe, they've
The,
been prescribing this for erectile dysfunction.
So going way back to 2001, I think was
Yep.
the first
Was the first
approval
approval.
in Europe. And the studies that really were showing effectiveness then were 2001, 2002. It's kind of reemerged a little bit, but again, not an FDA approved product in the sublingual form, which is the form that they're talking about for erectile dysfunction. And why is that? Because sublingual gets into the bloodstream fast, and so is fast acting. And so,
And you can use lower doses. So
correct.
safety
Yeah.
is a bigger thing on those lower doses.
Clearly safer in a sublingual than an injectable for
Yeah. And less
sure.
side effects, negative
Yes.
side effects, and
Yeah.
lower dosing.
And so basically, this is not an FDA approved form at all, except for that injectable in the United States, and that's for Parkinson's. And so, again, when we're talking about FDA approved products, if you're talking about a medication, most medications are used with off label uses. So if there was a product that was, or an antibiotic, but you're using it for something different, it may be an off label use, but you can still use it. And again, it's the practice of medicine and the physician deciding how to use it. And so this one isn't in an FDA approved form, in a sublingual form. So you cannot get it at a regular pharmacy, but you can get it at a compounded pharmacy.
It's
And
like
so,
another hot topic we'll be talking about and do a podcast on, which is clomin
yeah,
and clomiphene,
yes,
another medication that's used off topic
yes,
or off label for
correct.
hypogonadism or for testosterone.
Yes. And again, another
So,
one that is a
so
compounded
look out
version.
for that
So,
one. That one will be an interesting podcast coming.
yeah. And I would love to have Tim back on actually talking about compounded. And so let us know if also you wanted to talk more about compounding pharmacies and, the gap that they're filling in medicine to more customized products for patients.
And
And
off-label use of medications.
yeah. Well, and again, it is an FDA regulated pharmacy and highly regulated, in fact. And not all of them are sterile products, which means you're not injecting. So, but they actually can customize, they can combine different things that are very effective together, and it's safe and highly regulated. And I would love to open that conversation because there's lots of misperceptions still. And we have a pharmacist here in town that's excellent. And again, I'd love to have him back on just talking about compounding pharmacies.
So, side
again.
note,
So,
if you're interested in that, let us know. But in the meantime, pharmacies
yes,
like that are the reason why we're able to get sublingual medications like
correct.
the apomorphine
Yes.
for potentially for erectile dysfunction.
Yeah.
So, like we were saying, it is a dopamine antagonist. So it is
Actually,
or
agonist.
agonist.
But yeah,
Sorry, not
yeah.
antagonist.
Which just
Agonist.
means it's acting
mimics-
on the
it's-
receptor and not against it.
agonist.
Yes.
And
then,
dopamine is a neurotransmitter.
yeah.
That is our pleasure-seeking neurotransmitter, right? It's our reward system. We get excited about something and we get a dump of dopamine.
Yes. It has lots of other effects, and that's, that Parkinson's. But yes, that's a great way to like make sense of it. Just if you're thinking of apomorphine, have trouble memorizing, what it does or how it works, just think about dopamine. It works as increasing dopamine or, again, making that more active in the body and therefore pleasure. And so what we're talking about is ED. And so the studies that talk about that going way back, again, it is a centrally acting, so it works on an area of the hypothalamus, so in the brain. And so it is, again, potentially a little more faster acting for that reason too, where your PD5 inhibitors are working peripherally to increase blood flow. And so it could be faster, potentially, and again, within 18 minutes in the study that we looked at, and again, these studies go way back because it was approved in Europe in 2001. But Verde, you came across a very interesting fact about it, even in Europe, because when it came to reapproval,
Oh, yeah, they didn't reapprove it.
yes,
So in 2005 and 2006, respectively, because there was two different products approved, when you go on to the European version of our FDA, it's not very clear on why it wasn't renewed. It just says that it expired and it was not renewed. So that tells me it's even been withdrawn from their agency. So but it doesn't give much detail of why. And we can't really see anything in there super conclusive other than when we look at some of the potential negative side effects of the medication, right? The most common being nausea, but there were some vasovagal syncope episodes that ended pretty poorly, it sounds like,
but
with some
very
of those.
small amount, like 0.2%.
Yeah,
So
it was
not a
extremely
huge-
low,
Yeah.
but that was the only thing that I could really, when we were
Yes,
looking,
yeah.
that we could find that might be the reason why it wasn't.
And it sounds like all
Renewed?
of, and so when we're talking about pre-syncope, so somebody either passing out or coming real close to it, but it sounds like it was a 0.2 and it was syncopal, which means they passed out, but they had symptoms leading up to, which usually results in something not as serious a cause, but also not as serious an injury if something happens because you feel dizzy, you sit down, you lay down. And so it was like 0.2%. And it came to the conclusion even way back then that it was safe. There was nothing that we saw that was
Yeah.
unsafe about it. So it feels, maybe to me, it seems as if it just wasn't used that much or that often. And so again, we'll talk at the end of the podcast about that, specifically as it relates to our practice. But again, it relaxes smooth muscle, it increases your parasympathetic, which is in contrast to, again, Cialis or Viagra or, sildenafil or tadalafil, which is the generic names of those. But those are increasing blood flow and relaxing smooth muscle and getting the blood flow in. This is more of a parasympathetic, which does the same thing, but from a central nervous system action. And so
So a different pathway.
different pathway. So again, another potential oral agent that is, able to be used, but not from a regular pharmacy. So those are all compounded versions of it, but you can get it in a sublingual or a rapidly dissolving tablet. You can actually combine it with other things.
We saw that.
Yeah.
You can combine it with
Oxytocin.
oxytocin. And there was even a compound with one of the other PED5 inhibitors, tadalafil.
Yeah. And then
So it's
actually,
interesting.
I think that they also had it with something else that was unusual. I'll recall, but tadalafil, oxytocin, it can do that with apomorphine or alone. And there was something else that they had
Options are
compounded that
endless.
yeah. Well, that's
Your own little Willy Wonka of ED medication at the compounding pharmacy.
correct. Well, they are very creative, and I love that because they know whether they interact with each other and also know that it's like a similar, kind of symptom or, solution that you're looking for. And so they can combine those, they can customize it, they can change the dose a little bit, and they also know whether they are compatible. So those are things that you don't get from your regular pharmacist, that they can combine different things and, in one pill, and people would obviously love taking one thing versus three different separate,
Oh, absolutely.
yeah. So I think
Your
that
own little
that's,
personalized cocktail.
I know. Yes, that's what compounding pharmacies does for us, right?
it.
I know.
So, because this medication was approved in Europe and being prescribed on indicated for erectile dysfunction, it's nice that there's clinical studies that go with it. So, we were able to pull some pretty good studies. One of them had 5,000 men. So, that's a pretty good study when we're talking about a medication that was only around for approved for 4 or 5 years. But it was 5,000 men in phase 2 and 3 of that clinical trial. They were looking at different milligrams of use between 2 and 6 milligrams. What they found is the lower doses had better results than the higher doses, so less negative side effects, good sustainability, and that they saw that in that 5,000, on a lower dose, and they used the 3 milligram in that study compared to a 4 milligram. Erections firm enough for intercourse were 49.4%. Comparatively with the baseline of 24%. So that's a pretty big jump that they were seeing. There was another study that did a double blind where they also saw better results in a lower dosing as well. But in those studies, negative side effects, really the biggest was nausea.
Correct. And I think that like there is a recurrent theme that keeps coming up is placebo effect. So if you look at placebo effect alone, it's like a 40% improvement. So again, not to say by any means that ED or any sexual dysfunction in a woman is a psychological issue, but it does play a role because once you have any change in an erection that involves, something significant, such as, a sexual encounter, that does play into it. So if we were to give you something and 40% of men would respond, that's the placebo effect, which is strong. But again, 45 to 47%, and the one study got firm enough for sex. And again, 2 milligrams was a little bit less than, you were 1.6 times more likely. And then 3 milligrams, you were 2.2 times more likely to. But the nice thing, because you said sustainability, but also improvement. That was the one thing in that study. So if you had a subsequent dose, you had an increased likelihood of having a firm erection for sex, which was, I think, almost the first time we've actually seen that the more you use it, the better. And I would say that there's a placebo effect in operation behind the scenes there, because as you're starting to get effect, then you're getting more confident potentially, because it's still the same drug and it's a separate time that you're taking it. So
makes
it's not
sense
as
that
if
there'd be a little bit of that.
Yeah, unless if it's stored in the body or increases your dopamine in a more sustained fashion.
Well, in that same study, it talked about like the ideal candidate, right? Being mild to moderate erectile dysfunction, but also those 4 psychogenic concerns as well with erectile dysfunction. So a little bit with that placebo, but also with that dopamine, right?
Yes,
that pleasure center, that reward center, right?
Yes.
So it definitely makes sense that if they feel better, they're getting better erections, they're building their confidence.
And then subsequent doses would actually be better. And that's interesting too, because again, PT-141 has that central effect. And we've done a previous, podcast on that. If you're interested or don't know much about PT-141, it's a peptide for sexual function that works more neurologically. And again, also has a very positive, beneficial psychological effect and increases confidence in getting erections.
And we see improvement with erectile dysfunction with that peptide when we know that that peptide really is supposed to be more for libido, right? The neurological increase in libido. But we're seeing that improvement in erectile dysfunction. We're hearing that from patients, even though when we look at that peptide, that would not have been the first thing, is to use it for erectile dysfunction.
Yes.
It's for desire. But yet it leads to improved erections
so
in a lot of patients.
Yeah, ED is fun. And again, that one improved libido, improved orgasmic strength. And again, ED, and Faraday's correct, is that it's supposed to be libido and central. And this one, again, so has the same thing where it is that confidence builder potentially and dopamine. So it kind of makes sense. But again, those numbers specifically on your first dose, it was on 3 milligrams specifically, 53% in the fourth dose. So they've had it now 4 times, almost 75%.
Which is, so that's sustainability. That is continued improvement with usage.
Yes, yeah.
And like you said, that's not very common for us to see it to continuously improve. Typically, the response you get's the response you get.
Yes, because you're using it at a separate time. It's a drug, that has certain effects on the body, and this one has on a neurotransmitter. But like literally, you're using it a separate time. It's already gone from the system. So I think that is the one way that it would make sense, and it does all the same things that PT-141 would do, where you're increasing your erectile function. I know we're actually kind of sorting through this as we go.
Can we combine those two together?
Oh, yeah, that's... Well,
it's a question for the Willy Wonka of ED.
Yes, we'll have to talk to them about it, because PT-141 does have a nasal spray There was, not a
Oh, that's
lozenge,
right.
but
Yeah.
almost like a lollipop that was used at one point too. But mainly more effective
Look at that. We're coming up
injectable.
with
But yes,
medication
yeah.
combinations as we're doing our podcast.
Correct. Well, and not only that, so if we think about that from a psychological positive confidence, this one does the same thing. So it improves like drive, orgasmic satisfaction, ED. This one didn't improve desire. It had no change on desire. That was the
But
one thing that was not seen to be improved.
we're working on that pleasure reward system. You would think that
Yeah.
there would be a positive
And
response.
that was the one thing they didn't see. But if you could get orgasmic ED and then
Improved confidence.
confidence, then you can actually combine it with PT 141 potentially that does all that, but does drive too.
Does drive.
And so, yeah, interesting.
It'd be an interesting
Yeah.
combination. I don't know if
Yeah.
it's compatible. I don't know if there's interactions.
Yes.
This is just off the top, us
This is-
talking
this is
about the two different medications and going, ooh, I wonder.
Well, this
Something
is
to look
actually
into.
very similar to what we do in the office on a regular basis is kind of sort through things because some of this stuff is even for regenerative stuff, like you're combining things, you're thinking through things, and sometimes you can, as long as there's not safety concerns, and that's where you have other specialists or subspecialists like pharmacists that would actually know that because if you're compounding and putting it together. So,
And like you said, this is what
definitely.
we do get a little bit. You're seeing some of the behind the scenes. We are very comprehensive in our treatments, whether it's erectile dysfunction, whether it is aesthetics. If you watch our aesthetics podcast, if it's hormones, if it's IVs, if it's peptides, we're very, very comprehensive in the way that we treat. And we are always looking at multiple modalities to treat something. So
Yeah, I love that. And, I was just thinking in the back of my head that the first thing that George always says to me, Dr. Ibrahim, who has been on the podcast before, is every time I bring up something related to us thinking through what we can combine or do, he's like, well, you're the pharmacist. You should know, like, because I was in a previous life, but it's been a long
I
time.
love that in a
And,
previous
yeah,
life.
Yeah, so I basically would defer to, but again, we have some great
It's like
pharmacists.
I'm not
I
a doctor,
know.
but I play one on TV.
I know, yeah. In a previous life, I
A
was a
previous
pharmacist,
life.
but yes, I'm not going to say what's compatible, and that way we will defer that to the specialist there. So, but very interesting. Yeah, we'll have that conversation more after.
And there might be another podcast on it.
Yeah, we'll let you know what we find out. And especially if you guys are interested in that. And so we do want to know experiences with apomorphine if you have had that, because we would love feedback from men who have actually used it and what their reaction was, because it does have quick onset. The average time was 18 minutes. Or 18, a little bit over that
Yeah,
minutes.
18
so it's
to
very
19.
fast.
It was right there.
So a lot faster than Cialis and Viagra. And again, sublingual, so very easy to use. The side effect profile was not that bad. Nausea,
Yeah.
dizziness.
Some
And
headaches, but very, very low percentage in the lower doses. Those numbers went up on the higher doses, but a low dose seemed pretty effective from the studies.
yeah, and that's the nice thing about it. When you compound, you can actually change that dose a little bit. But 2 and 3 milligrams seemed a very reasonable dose. And again, syncope, which is passing out, was 0.2%, but they all had symptoms leading up to it. And so, just if you don't know syncope at all, like if you're passing out, you have no warning signs, that's a bad thing. That means something happened with your heart. So, most of the time, if it's a drug effect, you have some kind of symptoms with it because it's not a primary heart issue that's going on. So, but I think that otherwise, again, just kind of recapping, it's an interesting topic. We had patients reach out and ask, and it's not something that we were using on a regular basis. So to get to the point, are we using it in practice currently? And we haven't been at all. But we have it available in a compounded form from the compounding pharmacy that we use most frequently, but other options as well. And the more we researched it, the more intrigued we got about using it, and obviously even more intrigued during the podcast on maybe potentially combining
Combining it
it,
with other
yeah,
modalities.
with PT-141, or even if we weren't, we can still use it separately. PT-141 is a very favorite of a lot of patients of ours, and it's part of a comprehensive plan so that, again, as we're regenerating, we're getting better erection quality. You can also add in PT-141 for the confidence, but it's like everyone loves it. When do they love it? Because there is some nausea with it. There's some
There's
timing
some
issues.
timing issues.
Yeah. But then,
But if you're interested in PT-141, we've done a ton of podcasts on it. So look at our channel, and
yes.
there's a ton of information.
Yes, we will. We'll put those up, and again, click on those because they're very interesting. We did a long one that does more of the science, and then we did a shorter one, but the long one talks a lot about the science behind it. And so again, it's great confidence booster. It increases sex drive. That's what it's supposed to do, but ED and orgasmic strength. And it is for men and for women for that. And again, there's some issues that you got to sort through, but most people love it. So
And we're always here for our patients to help them sort through that. We get questions often
yes. And again,
and try to problem shoot that a little bit.
and that's what customization is all about, is like you are not like anyone else, and so you got to find what's right for you. So there's some standard things, and during an evaluation we'll figure out what your medical history is and where you are in your journey and the symptoms you have and the severity. But then there's all kinds of different things we can pull in, and we can customize it. And men will let you know what's working for them and what's not. And so
please leave us comments and let us
Exactly.
know. Have you tried the apomorphine? Does it work? Did it work? Did it not work? Did you have terrible side effects? Did you love it? Could you care less for it? I mean, we want to know all the things.
yeah, so definitely.
Because like Dr. Durr said, we're not currently prescribing it, but we are. This is the process, right? We are brought a topic, we research it, we look into it, and we go, okay, the safety seems to be there,
Correct.
but does it actually work in practice?
Correct. And I think that's what it is. Like, again, we will research anything before we do it. And so we are brainstorming, we're doing research and studies. We're going to do a podcast about it if it's something new to us. That's what this is about. And yeah, I'm all for using it. And again, it was a patient request that got us right here talking about it and deep diving into the science. And so we will
And I'd
proceed.
love in like 6
yeah.
months to be able to do another one and say, yeah, we're using it, we're loving it, it's fantastic, or it's one
Correct.
we might not continue. It might not be our first line.
Yeah. So
We've got it in our pocket.
correct. So we'll let you know. But also, if you're interested in that or you have had experience with it, please leave those comments. And again, I think right now in my mind, it's confidence, and it increases everything potentially then but drive. But there's other ways that we have to increase drive. So let us know, share, like, subscribe, and let us know what you want to hear more about, because we are willing to deep dive into anything sexual wellness or wellness.